First thing I'd like you to do is introduce yourself.
I'm Nate Wilmes with Excel Sports and Physical Therapy. I run the Outreach Athletic Training Services program.
Okay, Excel, there we go, Excel Physical Sports Therapy. We're out at Fort Zumwalt East. I understand you guys have a comprehensive concussion assessment and training program.
Yeah, basically it's called the impact test, and it's used as a comparative tool. It's a neurocognitive exam, and we test a lot of different athletes, football, cheer, soccer, with getting started right now in the spring. And it's a neurocognitive baseline exam to kind of give us an idea of how the athlete is pre-concussion. And then if for some unfortunate reason they should have concussion during the season, we can kind of compare apples to apples. And again, it's not an end-all be-all, but it's a comparative tool to kind of see where that athlete is, how she, if it's girls soccer, how she relates to today during the season.
So, and it's a fairly standard test in my research. This is a national test that you're just providing the tools to take for the school district to take advantage of.
Basically purchases a certain amount of pre-assessments, and then they just use them as they need for their sports, and the post-test is already in that price.
And what I just observed was a group of 30 young ladies at computers taking that cognitive test as you described it.
Correct.
So what comes out of that is, as you noted, a baseline, an understanding of where their cognitive capabilities are now.
Correct. And all that data gets logged in. It's on a website that the athletic trainers can access, or the Dr. Larkin is the overseeing physician.
Mm-hmm.
He can go in and kind of compare a pre-test to a post-test after a concussion, and kind of compare, if the athlete's still having problems or not, looking at the data rather than just based on subjective symptoms reported by the athlete. They can go in and look at hard black and white data and decide this athlete needs a little more rest or time off or whatever.
But that's what I understand. There are now some new rules as well that indicate if a kid gets taken out, this is how you start the clock, so to speak?
Correct. This kind of gives us an idea of how close they're getting to return to play. Initial rules now indicate that once an athlete's asymptomatic without medicine for 24 hours, they can kind of start a return to play protocol. It's anywhere from a 5 to 7 day return to full gamesmanship, full games play.
Right.
So it's not once you're cleared by your doctor and you pass this test, you step back on a field to play the next day. There's a jog. Day one's like a jog.
Mm-hmm.
Day 2 is a jog and lift. Day 3 is jog, lift, do some exercises, weight room, and you kind of progress to part practice, full game.
And that's where professionals like you come into play. Your ability to interpret the differences in those tests.
Correct.
That can help you measure where the kid is. Well, to your point, you said subjective versus now an objective test that tells us not just how bad the headache is, but what effect it's had on their skill set.
It'll map out like where they were. If they take a pre-test, the first pre-test will kind of map out compared to a second pre-test, and if they clear and they pass that, you can kind of see that they are slowly getting the neurocognition back. Okay.
And this, again, is a service that Excel Sports offers to not only Fort Zumwalt, but you're doing the Francis Howell School District?
Francis Howell is another school district that purchases these services. We implement them at the high school.
So anybody that's interested can contact Excel Physical Sports Therapy. And
the website is www.excelsportspt.com. And my cell phone, if anyone wants to call me, is 314-805-4627. And you can call or text, whichever is easier.
Thank you very much. I really appreciate it.
You're welcome.
And this is some of the kids that you guys are helping.
Yep. Some of the probably 100, 125 just out here today.